Hi, thanks for coming in. So, I will talk to you this morning about carpal tunnel syndrome. I have a lot of slides to go through, so I'm going to go through them rather quickly, and hopefully have time for questions at the end. These are my disclosures. I'm a consultant for Acelity, I'm a consultant for OpPen. My brother had carpal tunnel syndrome. He got better without surgery, and he usually doesn't listen to me. And this is one of the few times he did. And we'll maybe talk about that a little bit later. So we're going to talk about the history, the physiology, the diagnosis, and treatment, as well as the controversies. What's interesting is carpal tunnel, if you guys remember in 2001, actually made it to the Supreme Court. There's actually a Supreme Court case about carpal tunnel syndrome. And it was Williams versus Toyota. And it was basically talking about whether just someone who has carpal tunnel syndrome can be declared disabled, or whether you need something else and whether it's certain characteristics. And Ms. Williams lost, Toyota won, and it turns out that you need more qualifications rather than just a diagnosis for disability. This is the other thing about carpal tunnel syndrome. I see it all the time, even my patients who are coming in for something else. So, and there is a lot of workman comp issues and a lot of worker issues, and you're wondering, how's he going to get to this pizza story? Where is this coming back? Well, here it is. So I had a guy come in, he came in for something with his foot, and he's like, by the way, doc, I have this numbness in my hand. I'm like, well, you know, of course in my history, I'm like, what do you do? He goes, I'm a pizza cutter. So he works at Domino's or one of these pizza places, and that's all he does all day is cut pizza. So I'm like, you know, this is interesting, because this guy is definitely probably from this pizza cutter, because it's only on his right hand. So I said, I want you to just change your pizza cutter. So he changed his pizza cutter. I saw him again about just maybe 3-4 weeks later, completely cured. So a lot of times with carpal tunnel, if you can notice that the person has this repeated injury, by the way, this is on the right. This is not the one he used over here on the right. But I do that in any way, saying you want to just change. So ergonomics is pretty important. Is there a laser pointer on this? Got it. Black thing. Okay. So ergonomics. This is one of my favorite South Park episodes. The guy on the computer, and he's wearing the carpal tunnel thing on the right. Very, very classic. This is a self-portrait of me, actually. And getting back to my brother. He's got carpal tunnel, and I'm like, listen, you know, he's an electrical engineer. He's on the computer all the time. But he's got carpal tunnel because he and I are playing online video games with each other all the time. So I said to him, listen, what I need you to do is just change your mouse. So he changed his mouse. Carpal tunnel immediately got better. So I was able to diagnose him and make him better without surgery. And again, we have all these ergonomic keyboards. And you'll see when we talk later, having your shoulders down, your hands like this, and working on the computer really has an effect on your carpal tunnel. So I'm going to go through the history perspective really quick. It was actually described in the 1840s with nocturnal hand paresthesias. It goes far, as you know, it always goes farther before. We always say things were, you know, discovered in 1850, and then you look back in the literature. It was really about 200-300 years ago that it really happened. But it was really the early 1950s, and it's really the most common form of compressive neuropathy. Anywhere on your body, you can have a compressive neuropathy. There are all these places on our body where a nerve is going through a smaller canal. And it's usually a burning pain, numbness, pins and needles. And I think a lot of people in this room, I know we're all kind of in medicine, but every once in a while I will be working on the computer or I'll be doing something and I feel numbness in my index finger, middle finger, and thumb, and I know to shake my hand and move it. The other thing is usually happens, people will also complain that if they go out for a salt meal, Chinese food for example, people will come back and say, I have carpal tunnel, and it only comes and goes. And then I said, did it happen after you had a big Italian meal or a big meal with Chinese food? And like, yeah, come to think of it, when you do that, you retain water, you have this whole salt load, and even that slight difference, the way I describe it is this. If you're in a swimming pool, and the water comes up to your top lip, you're fine. You're just walking around the pool, you're having a great time. If you add 1 inch of water to the pool, you drown. And And that's really what's happening with a lot of people who have this borderline carpal tunnel. Slight changes in fluid dynamics in your body or fluid in your body will cause the symptoms. And it occurs at several locations, which we'll talk about, ulnar, radial, and we'll talk about these later on today. And nerves have motor, sensory, and sympathetic fibers. With carpal tunnel, obviously your sensory are index finger, middle finger, and thumb, and then your muscles to your first and second lumbrical, and so your index finger, middle finger, lumbrical, and the thenar muscles of your hand. Up to 10% of the general population will suffer from neuropathies, and the most common of these is carpal tunnel syndrome. Now, I'm bringing up this story. I had to put up a guitarist, and I said, Eric Clapton reminds me of one of my old partners. So, a lot of times people have carpal tunnel and they don't even know it. And I had a patient come in who actually was a friend, and he was coming in because he thought he had some kind of global neurological problem. I said, well, do you have any numbness in your index finger, middle finger, and thumb? He said, no, but I can't play the guitar anymore. There's something clumsy about my hand that I think there's something wrong. I want to see a neurologist. So a neurologist said, I have no idea what's going on. So he went, I said, well, why don't you just go for an EMG, just to see. So he went for an EMG. Turns out he had carpal tunnel. Normally the sensation happens, but it can present on a very low level, such that he couldn't really have a sensation problem that he could discern. However, his hand needed such a high level of function from his guitar playing that even having a small deficit, he noticed. Most of us don't even notice a small deficit until it goes along, and Steve and I see this all the time. A patient will come in, the whole thenar muscles are gone. And you're like, do you have carpal tunnel? Like, no. Do you have any numbness here? Yeah, a little bit. Meanwhile, they must have had carpal tunnel for years. So each patient presents differently, and each patient's symptoms present differently.